Good morning, I'm Sheeba, Varickappallil, FNP student at Naval University, St. Louis, Missouri. This is my head-to-toe assessment. This is my patient, Mr. H.J., and he's 20 years old. We already performed his vital signs and it is stable. He's afebrile. His height and weight are normal. He's 5 feet 9 inches and his weight is 140 pounds and his BMI is normal. And H.J., I'm going to perform this head-to-toe assessment. I have to listen to you, I have to inspect you, I have to palpate, I have to tap on you. During that time, any difficulties, you can just stop me and we'll proceed after that.
Okay.
He already emptied his bladder and he's in a comfortable clothing for the assessment. And I already took health history from him and his speech is clear. He's very pleasant, he's appropriate effect, and there was no abnormal. And his gait and his cerebral functions are normal. His balance was normal. Now I'm going to inspect his. We already checked his visual acuity, and he has with glasses 20 by 20 vision. And now I'm going to check his near vision with the Rosenbaum chart. Can you read that last line, please?
BCD.
Can you close one eye and read with each eye?
All right. BCD.
Okay.
BCD.
All right. Thank you. His vision is perfect. Now I'm going to proceed to his head and face. First, I'm going to inspect his skull and scalp. His skull is normal size and shape. He's atraumatic, normocephalic. There is no tenderness, no edema, no tremors. And I'm going to palpate his scalp. He does not have any lesions, any tenderness, no edema, no lesions. And I am just checking his hair. He has good hair growth, and the hair distribution is normal. With some other disease conditions like hypothyroidism and hyperthyroidism, the hair texture can be different. His hair is healthy and normal. Next, I'm going to palpate his facial bones and sinuses. Can I borrow this?
Yeah.
Thank you. First, I just observed that there is no temporal artery bulging or tightness there. And I'm going to palpate his sinuses, the frontal sinuses. Do you have any tenderness?
No.
Maxillary?
No.
Any? Sphenoids? Ethmoid?
No.
Okay. And his facial bones are normal. And his ears and his eyes are symmetrical, placed on the skull bilaterally. And I'm going to check your temporomandibular joint. Can you open your mouth? Close. Open again. Close. Do you have any clicking, any popping, any tenderness?
No.
All right. That's normal. Now I'm going to check your jaw muscle for the tone and the strength, which is cranial nerve 5, the trigeminal.
Mm-hmm.
Just clench your teeth. It is strong. Thank you. And now we are going to check the sensation. That is the sensory function of the trigeminal nerve. Close your eyes and tell me whether you can just feel the touch, light touch.
Yes. 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 Yes.
Thank you. That's normal. Now we are going to assess his cranial nerve 7, which we have to do some facial expressions to do that.
Mm-hmm.
Can you frown your face? Can you wrinkle your forehead? Can you close your eyes tight? Open? Can you puff your cheeks? Can you smile? All right. His cranial nerve 7 is all perfect. Now we are proceeding to the eyes, the eyebrows and eyelashes. The eyebrows, the hair is normal. The eyebrows extensions are normal. The eyelashes are normal. There is no discharge or no hair loss or anything like that. Now I'm going to inspect his eyelids, and there is no flakiness, no discharge, no edema, and looks fine. Now let me check his lacrimal apparatus. Is there any tenderness? There's no tenderness, then I cannot feel any nodule or any changes with the hypercholesteremia or anything like that. It looks perfect. Now we are going to check the sclera and the conjunctiva. When I am going to look at the sclera and conjunctiva, you can look both sides.
Okay.
To the other side. Thank you. His sclera and conjunctiva looks perfectly all right. There is no redness, no discharge, no tearing, no edema. It was absolutely fine. Next, we are going to check the the peripheral vision. For that, I want you to close your eyes with the cards, and then just let me know when you can see my fingers coming in.
Okay. Yeah, I see.
The other side.
Yeah. Okay.
Right. That is to check the peripheral vision, and his peripheral vision is normal. Next, we are going to check the extraocular movements, which is checking the cranial nerve 3, 4, and 6. I'm going to the tip of the pen light. I'm just going to move this pen light, and I want you to follow the pen light, but don't turn your head.
Okay.
Good job. That was normal. Now we are going to check the corneal light reflex. For this, I'm going to put the light at the bridge of your nose, and then I'm going to check the balance of the extraocular muscles.
Yeah.
And if the light is shining symmetrically both eyes, that means you don't have any strabismus and your extraocular muscles are in balance.
Okay.
I wanted to look at that one point down there. Yes. The light was shining symmetrically both eyes. So when that test is normal, we don't have to do the cover-uncover test. Next, we are going to do the pupillary reaction. I'm just going to check the light reflects to the pupils, and I have to see the direct and the consensual. The direct and the consensual. The eyes, the direct. It's brisk, it's round, and it's reacting to the light, and the consensual. It has it is reacting to the light as well. Now we have to do the ophthalmoscope and check the fundoscopic examination of the patient. It's going to look into your eyes. Just to check your red reflex and your fundus of the eyes, that it looks normal. And I'm going to check the other eye. You can see the red reflex and the fundus is fine. the blood vessels were coming out, and then there was no signs of hemorrhage, and I couldn't see any diabetic changes in your further examination.
Okay.
Next, we're going to proceed to the ears, and I'm going to inspect his external ears. And his external ears is symmetrically placed, and it is normal size and shape. There is no nodules or any tenderness or edema or anything like that. Now I'm going to palpate it, and there's no tenderness. The auricles are absolutely fine. There's no problems. Now we have to check his hearing, which is the vestibulocochlear nerve or the cranial nerve 8, which we have to do. First we have to do the whisper test, and then there is 2 more tests, that is the Weber test and the Rhine test. So I'm going to whisper something in your ears, and then you can close your eyes with the fingers, and then if you can hear and repeat it. Okay, close your ears.
Dog, cat, bird.
Can you try the other ear?
Red, white, green.
Excellent. That was good. Now I'm going to use the tuning forks to use the other 2 tests. And for that, I have to vibrate the tuning fork, and I have to put it in the middle of your skull, midline to the skull. And then this is to check your unilateral hearing, and tell me if you can hear to the right, to the left, or to both ears.
Okay. I heard in both ears.
Excellent. That's how it's supposed to be. And you have the conductive and sensory neural hearing is appropriate.
Okay.
Next, this is called Weber test, the one we perform now. The next one is Rhine test, which is the air and bone conduction. Mm-hmm. And for this, I have to vibrate the tuning fork, and I'm going to put it in the master process of behind your ear. Mm-hmm. And then you can tell me whether when you cannot hear anymore, tell me, and then I am going to put it in front of your ear, and then you can tell me when you cannot hear.
Okay. No. No.
Okay. Check the other ear.
No. No.
Excellent. For this, we know that the air conduction was twice as the bone conduction, and his study is normal. Next, we are going to check with the otoscope your ear canal and your tympanic membrane. Going to pull backward. You can see your ear canal. There is no excessive serum, no tenderness, no edema, no discharge or anything like that. I can see your landmarks fine, and your tympanic membrane is really great. Check the other side. Everything is similar, like the other ear. There is no abnormalities. Thank you. After the ears, we are going to inspect his nose. First, I'm going to inspect his nose, and then the nose is normal, the size is normal, shape is normal, the nares are symmetrical, and it's midline. And I'm going to inspect the. Can you just breathe through each nares? That is to check the patency of the nares. I'm going to look into your nares just to see the turbinates and the internal mucous membrane. Mm-hmm. Your turbinates are normal. It's pink. There is no inflammation, no discharge, no edema, no polyps. and your septum was midline. There's no deviated nasal septum. Now, with this, with the cranial nerve 1 is the nerve which checks the sense of smell. So I want you to close your eyes. And can you smell this and tell me what the smell is?
It's a lemon.
All right, thank you. The sense of smell is intact. Now we are going to check his mouth, pharynx, and the internal oral cavity. For that, I'm going to use a tongue blade. Just open your mouth. Just going to check your oral mucosa, and there is no lesions, no nodules or anything like that. His gums are normal. It's pink, and there's no bleeding tendencies. There's no hyperplasia, and the tongue is normal. It's midline. It's pink in color. There is no lesions. Can you touch the tongue to the other side? I can visualize the lateral aspect of the tongue. There is no the other side. Excellent. Lift your tongue. I'm just looking at the floor of the tongue. There is no lesions or ulcerations. And can you say ah?
Ah.
That is to check his cranial nerve 10, and the uvula was midline and it was rising. And I did check his soft palate and the hard palate, and there is no abnormalities. His tonsils are removed, so I cannot really see the tonsillar pillars and the tonsils. Can you swallow? That is to check the cranial nerve 10 also. Now, I wanted to, there's a cranial nerve 12, which is the hypoglossal. Can you stick your tongue out? Can you move the tongue side to side? Excellent. Can you push it against my hand? And the other side. Excellent. That cranial nerve is normal too. Next, we are going to inspect his neck, and I just wanted to tilt your head. And can you swallow? The trachea is in midline, and there is no pulsations, abnormal pulsations, no masses or anything like that. I'm going to palpate his thyroid. Just swallow. There's no abnormal growth or enlargement of the thyroid, I can see. Let's do the range of motion of your neck. Can you bend your neck? Up, extend, rotate. Excellent. Can you, against my resistance, turn your head and neck and to the other side. This is to check the sternocleidomastoid muscles and the range of motion of the neck, and he's doing, he has done it fine. And then, can you shrug your shoulders against my resistance? That is to check the cranial nerve, the 11, which is the spinal accessory. And whenever I checked, I was checking for the JVD. There was no jugular vein distension for him. And now I'm going to palpate his lymph nodes. It's the preauricular, postauricular, the occipital, the tonsillar, the submandibular, submental, superficial clavicular, cervical, superficial cervical, deep cervical, and the posterior cervical. And this is the superficial clavicular and the subclavicular nodes. And I'm going to check your axillary nodes. There's no inflammation or node enlargement for him. The lymph nodes were normal. And I'm going to just check his carotids one at a time. And I'm just going to hear if there is any brui or any abnormal pulsations. Can you take a breath and hold it? That's it. Take a breath. Hold it. Thank you. Breathe. Those findings are normal. Now I'm going to inspect his upper extremity. And the upper extremities are the color, the temperature, the muscle mass, the hair distribution, the fingernails. I'm checking for the capillary refill. It's normal. Can you push down and push up? And I'm supposed to check bilaterally and it looks fine. And I'm going to check his pulses, the radial pulses, the brachial pulses. And we can check the epitrochlear lymph nodes right here too, and for him it is fine. For the cerebellar functioning, we can do the rapid rhythmic movements of the fingers. So if you could do the touch the fingers with in order, excellent. And for the fine motor function, can you touch my nose, touch your nose, and touch my index finger? Thank you. Next, we're going to inspect your lungs. Can you remove your top? First, I'm going to inspect. There's no scars. The breathing is very symmetrical and it is normal. And there's no difficulty in breathing, no stress, no extra muscles are used for the breathing, and the ribs are not protruded or anything like that. The anatomical structure is absolutely fine. Now I'm going to Now I'm going to check his lung expansion. Just place my thumb on the costovertebral angle, and I'm going to, take a deep breath. Okay, down. One more. And my thumb are moving bilaterally, symmetrically. So I'm going to do the anterior chest for the expansion. Okay, take a deep breath, and it's moving symmetrical bilaterally. Thank you. Now we have to check the tactile parameters, which is the vibration of your lung fields. And I'm going to palpate, and then you can say 99.
Okay. 99. 99. 99. 99. 99. 99.
Excellent. All the vibrations are symmetrical and normal. There was no abnormalities. Next, I have to percuss for the anterior, posterior, and lateral chest. I want you to fold your fingers, arms in front of your chest, and yeah, that will expose your back. So. Can you lift your arms up? It's the lateral side. You can keep it up. Thank you. It was absolutely fine. Now I have to check the diaphragmatic excursion. For that, I'm going to take a deep breath and hold it. Now I want you to take a deep breath and breathe. Take a deep breath and exhale it completely. It's around 3 centimeters, and 3 to 6 centimeters is normal, and we can check that bilaterally. And he's absolutely fine. Next, I have to listen to his lung fields, auscultate. Take a deep breath. You have to take your time and listen to your chest, and there shouldn't be any crackles, any visas. It's all symmetrical bilaterally, and there was no adventitious breath sounds I could hear. Next, I'm going to check his heart and the precordial area, and there is no scars, there is no heaves and no thrills. And let me check the sternum. I cannot feel any heaves or thrills. And I'm going to check the point of maximal impulse. All right, excellent. Now I'm going to listen to the heart sounds. Relax your arms. It's your aortic, it's your pulmonic, your Erb's point, your tricuspid, and your mitral. There was no murmurs, no brouhaha, and everything, all the vascular sounds were normal. Now I'm going to inspect his abdomen. Can you lie down this way? I'm going to inspect his abdomen. There is no scars, no abnormal pulsations, no masses, and the contour is symmetrical. I can even flash a light across the abdomen and see whether there is any masses or anything like that. No, he's fine. Now I'm going to auscultate for the this umbilicus is midline and it's inverted. And I'm going to auscultate for the vowel sounds from the right lower quadrant, upper quadrant, left upper quadrant, left lower quadrant. Good. And now I can listen to the vascular sounds on the abdomen. I can listen to the aorta, to the renals, to the iliac, and femur. There was no abnormal sound heard. Next, we have to percuss for the liver borders and the splenic liver borders and the splenic dullness. And for that, I'm going to percuss the midclavicular line down until I can hear the dullness. Alright, and then I'm going to start from the umbilical area, same midclavicular line until I can hear the dullness. Alright, that's between, it's around 6 centimeters and 6 to 12 centimeters are normal. Now for the splenic dullness, can you extend your arm? It's the mid-axillary line, and you are listening for the dullness for the spleen. It's around there. It's the 10th and 11th intercostal space, actually. And now we had to do the light palpation and the deep palpation. The light palpation, you can keep your arms down. Thank you. Just all the quadrants. There's no muscle mass or anything abnormal I can find. Now I can do the deep palpations. It's absolutely normal. Now I'm going to palpate for the liver. So the costo, this angle, keep your arm on the top of the head, and then one arm underneath, and take a deep breath. When they are doing the inspiration, the liver has to move down. So I cannot really palpate it. Now I'm going to check the spleen, palpate the spleen. You cannot palpate it actually. And now I'm going to check for the right and left kidneys. We can feel the round mass in between your arms. if it is inflamed. Sometimes he can feel it if they are very thin, but for him I cannot really palpate the kidneys. Now, can you sit up? Thank you. We are going to check his feet and legs and inspect for the hair distribution, bilateral edema. There is no edema, and his fingernails are, the toenails are fine. And I'm going to palpate his pulses, the dorsalis pedis, posterior tibial, and the popliteal. And there's popliteal lymph nodes you can check also. And we are supposed to check bilaterally for the pulses and the muscle strength and everything. Now next, we are going to check the reflexes. Then try the knee reflex. Select. Now it's the brachial reflexes. Alright, now we are going to do the Achilles one. And the other side. All the reflexes are normal. Now I'm going to check his cervical spine, thoracic, lumbar, and the sacral. His spine is in the midline. There's no curvature. Is there any tenderness?
No.
Any pain? Can you stand up? Can you turn your body? No. Just stand there and just turn your body. That is good muscle strength for the hip. Can you squat? That's a good muscle strength for the legs. We are done with the head-to-toe examination, and your examination was absolutely normal. And thank you very much for cooperating with me.
Thank you.